Hi, I'm Mark Doebele. I work for Teton Therapy in Riverton, Wyoming. Today we're going to go through some standing exercises, mainly for the lower extremities is what we typically work these with. But we're going to start out with standing marching, which works the hip flexor, the front muscle in the front of the thigh. Basically, we'll always want people hanging onto this, a bar, a couch, kitchen counter, back of a chair, something like that. Typically, we always go at least 10 reps, sometimes 15. You can put ankle weights on the ankles while we're doing these to make it a little tougher. But this is the standing march. We're just lifting our knees straight up in the air. Most of the time we alternate legs, so it would look a lot like that. A little pause at the top, nice and slow in control motion. The next exercise we'd work on is called standing hip abduction for the side hip muscle. Looks a lot like this, straight out to the side. Toes are always pointing forward instead of out. Always going out to the side with the toes straight. These we typically just do one leg at a time, but we have some patients that like to do the alternating legs back and forth. So nothing wrong with doing that either. So the next exercise we do in the standing position is what's called the standing hamstring curls, where we're just bringing our heel towards our buttocks. Our knees kind of stay beside each other versus this. So it looks like that. This one you can alternate as well if you want. Like I said earlier, usually we do 10 to 15 reps of these standing exercises. The next one we like to do is called hip extension. So it's straight leg back, which works the buttocks muscle. 10 to 15 reps of these, nice and slow in control. Another one we like to do in standing is the calf raise. About hip width apart, just going right up on our toes. Nice and slow coming down. 10 to 15 reps of those as well. Another exercise we like to do in standing is basically the mini squat. So it looks like this, maybe a little wider than hip width apart. Buns are going to stick out like we're going to sit in a chair, preventing our knees going past our toes. So it looks a lot like that versus that. Like to keep our knee back and our buns out. So 10 to 15 reps of that, hanging onto the bar, the couch, the chair at all times.